invite people to help and identify themselves if you do have topics, interesting topics and developments and tools that you wanted to share with this forum and present. Before we move on to our topic, speakers and the speaker for today, I would like to let you know that the session is being recorded. You've just seen the announcement popping in. And this is so that we can archive, for those that weren't able to join us today, archive them on our website. We archive them both on the CLRI website and the behavior support, and our moderators will post those links shortly so you know where to find previous sessions and where to go to find the recording of this session as well. In addition, towards the end of rounds, we will be posting 2 quick poll questions that will pop on your screen. We really ask that you take a minute or 2 to participate. We rely on your feedback to make those rounds relevant and effective and beneficial for our audiences. So please take time. We will also send you some a bit of a longer survey, but really is quite brief after rounds that we would really appreciate if you fill out as well. Our speaker for today is Brittany Stanley from the Canadian Mental Health Association. She will provide a workshop today on the topic of understanding suicide. We felt that the current added strain of the pandemic and with the social isolation, especially to our elder adults, has definitely heightened the need to speak about this topic, and that's feedback that we got from partners and stakeholders across the system, that this is something that we're dealing with right now. We're seeing increase in, and so we wanted to bring this as soon as we can to the rounds to address this topic. So let me tell you a little bit about Brittany. Brittany is a speaker, trainer, and facilitator, educating communities around the GTA on topics of mental health and mental illness. She's a graduate from Waterloo University with a degree in environmental management, and Sheridan College graduate with a diploma in outreach and youth services. Upon graduating from Sheridan, she was a recipient of the J.D. Atkinson Award for High Academic Achievement and Community Service, as well as a silver medalist for academic excellence. She's trained in Safe Talk, first aid, mental health first aid, CPI and assist, applied suicide intervention skills training. And Brittany's passion for helping youth, adults in their families better understand and cope with mental illness is her driving force. Her interactive presentations and workshops inspire attendees to share their stories and to seek assistance. Brittany's eagerness to motivate, educate, and inspire her audiences continues to be her driving force to success. So really, thank you for being with us today, Brittany. I think we'll all benefit from your experience and passion for this topic, and we look forward to engaging on this topic, around this topic today with you. So I'll hand off the stage to you to take us through this workshop. I guess I will mention that if anybody wants to ask questions, you could unmute yourselves and join, or you could post on the chat. We will be taking questions throughout, and also we'll leave additional time for questions at the end. Thank you.
Yes, thank you so much, Einat, for that wonderful introduction, and hello and welcome to all of you here today with us. Of course, this is not how any of us are really used to learning, and especially me as somebody that works with people hands-on and as a trainer and educator. I wish I could be with you there in person today, but it just goes to show some of the challenges that we are all facing right now during this pandemic and what we've been facing for a longer period of time. So again, thank you so much for having me today. We are talking about a very, very important subject, understanding suicide. And this is always important. This is always a relevant topic topic, especially when talking about mental health and mental illness. But today, more than ever, especially during these challenging times, suicide is at the forefront, and there's a lot of people that are very much struggling right now. And suicide has come to be more of a common topic, unfortunately, right now with the world that we're living in. So Enat and Salma and everyone from the team, again, thank you for having me today. I am here from the Canadian Mental Health Association Peel Dufferin branch. So I want to start off just a little bit today. I'm mindful of time. There's so much content to get through. Just a quick background of what CMHA is. We are not CAMH. We get confused for CAMH all the time, but CAMH is a hospital. So the Center for Addiction and Mental Health down in Toronto. Canadian Mental Health Association is a national organization, and we are a community-based organization. So we have over 31 branches in Ontario, covering different sites and covering most of this province. So if you're not specifically in Peel Dufferin, where I'm located, there's multiple branches across Ontario, and I'm going to talk in the end how you can research and find your local branch. All right. So we do a lot of different types of services through education, advocacy, and research. And these services and types of things they do vary from branch to branch. So it's always good to look into your local CMHA to see what they offer in terms of support and services for your community and for individuals that maybe you're supporting, or even for yourselves and for your family members. I want to jump right into content today because there's so much to talk about around this subject of suicide. And to start us off, I think it's really important that we kind of look through the lens of some of these just suicide facts that we have and some of these numbers, because they pretty much take you aback when you see some of these. And simply just looking at 1 million people worldwide die by suicide annually. That's a very, very large number. And 10 Canadians die by suicide every day. And it's the 9th leading cause of death in Canada after cancer, heart disease, and accidents. So it's pretty high. So looking at these facts, it's very, very apparent that this is a large problem, not even just in Canada, but worldwide. And it's something that needs to be talked about a lot more than it is. I know a lot of people are uncomfortable when they hear the word suicide, and we don't talk about it enough. And there's a lot of stigma associated with the word suicide. And it's really important that we try to reduce that stigma, as whatever background we're coming from, whether we're caregivers, whether we're students, whether we're working in this field in different capacities, whether we're just a human being with our family members. Having these conversations and talking about suicide to reduce that stigma is so, so important to assist those people that are struggling, so they feel more comfortable to have these conversations. And it's easier to have these conversations because they're vital to the recovery and the support for that person. Now, when we look at some of these facts, you can see that it states things like died by suicide. So in order to help reduce that stigma, in order to talk around the conversation about suicide, we all have to be extremely mindful of the language that we use when talking about it. So something like commit suicide. This is a term you hear a lot. This is how people used to talk about suicide. But imagine what that word commit means. It means almost like we've committed a crime. It has such a negative a connotation to it. So just being mindful of how we even speak about it, the language we use, not only when we're talking about the subject, but when we're talking and supporting individuals. So instead of saying commit suicide, let's reroute that language to died by suicide, or even failed attempt at suicide. We hear this a lot. Somebody had a failed attempt at suicide. Imagine somebody struggling with those emotions, those feelings that they're having, and they hear they had a failed attempt. Their mind would go straight to, look, another thing that I'm not good at, another thing that's I can't do. When we look at people that are living or survived cancer, we call them survivors, we call them warriors. Yet the language we use around mental illness and things like suicide are so much more negative and have that negative a connotation to them. So what's so important around this conversation, as we facilitate it and as you continue to have it with people in your lives, be very mindful of that language that we're using to have those conversations and facilitate them. Now, a few more facts around suicide. For every death by suicide, there are 5 hospitalizations for self-inflicted injuries, 25 to 30 attempts to die by suicide, and 7 to 10 people profoundly affected by suicide loss. And we have to remember, death by suicide, there is no single cause when someone dies by suicide. It's a result of prolonged pain or experience by that individual. And they may have increased many setbacks. They may experience many setbacks in hospitalization or attempts before they die by suicide. So we have to keep these things in mind. And then fewer in 1 in 5 of those who die by suicide leave a note. Fewer than 1 in 5. So there's not always a reason or that note associated with it, like we see a lot of the times in press or in social media or things like that. So just a few facts just to wrap our head around the impact that suicide has on all of us or in life, and how unfortunately common it is, and especially in challenging times like we're in with the pandemic, the increase in the amount of people that may be having thoughts of suicide right now. So another little fact is to look at, and I want to ask this question to all of you, and if you want to answer in the chat or raise your hand, that would be great. But more men than women are likely to die by suicide. And based off our statistics, more men do die by suicide than women. Does anybody have an idea as to why that could be? Why do we think more men die by suicide versus women? Does anyone have a thought or want to share why they think that what the reason is behind that?
I think because they do not express themselves, they isolate themselves. They think they can handle it by themselves, and then they become overwhelmed. Unlike females who share their feelings and emotions because we're more emotional than men are, or most men are. I think it's just a being macho.
That's a really good point, and you're absolutely correct. A lot of that comes from that stigma around men in general, and I see a lot in the chat as well, coping stigma around men and mental health. And women are more likely to seek treatment. Women are more likely to talk about the emotions, more likely to talk about what they're experiencing than men are, because that stigma around men, and we bring men up to feel like, oh, you're macho, men don't cry, we don't do this. So they have this mentality and they are more hesitant to get help. And a lot of you are expressing that in the chat. And thank you for sharing that. I see one more hand up. I'm not sure if that was who just spoke right there, but okay, it's down now, so it might have been. But thank you for sharing that. I also see someone has written more lethal attempt, and that is also a huge part of this. So women are 3 times more likely to attempt suicide, but the means in which men use are more lethal. So men choose more lethal means such as hanging or a shooting to die by suicide, versus women using other means that aren't as lethal. So that's why we see that in men a lot more. So there's a few factors that's contributing to that statistic, but those are exactly those reasons, right? So lethal attempts, less likely to seek treatment or help, and less likely to talk about what they're experiencing. So well done, and thank you for all of you that communicated in the chat there. There was a lot of responses with that one, so thank you. So let's go to that question then, why? So we talked a little bit about gender. Gender plays a huge role, but in terms of suicide affects all individuals regardless of social and economic class. So suicide, you can see, is worldwide. It affects different people from different backgrounds, different races, nationalities, whatever that may be. It is a part of human beings, unfortunately, that are struggling, right? As human beings, we have emotions, we have mental health, and we have things that affect that, right? So there's a lot of reasons why people die by suicide, and it's never one specific factor. There's a lot of a lot of different factors that come in that bring someone up to that level, and everybody is different. Everyone's experiences are different, and suicide behavior can be for an array of reasons. And I know a lot of people want to ask why and want to have that question answered, why. And some people don't even know all of those specific answers. It's coming from a combination of things for a lot of people. Now, I know when talking to people that either have died or people that have been experiencing thoughts of suicidal or suicidal ideations, a lot of people express that the amount of emotional and mental pain that they are experiencing is so great that they need that pain taken away, and they don't know how to do that. They don't see that light at the end of the tunnel. They don't see any means on how they can possibly get through what they're experiencing or how it can possibly change. And more than anything, they just want that pain to go away. Or people have experienced trauma, huge traumatic events or multiple or ongoing trauma, generational trauma through their lives that have impacted them to a point where they don't know how to work through that. They can't get over that, and it's affecting them so much, and they don't know what to do, and they don't see any way out. So there are so many different factors bringing them in, right? Bringing them in to this point where this is the only way. So I have a question there. Can depression, stress be underlying reason for suicide attempts? Absolutely. So depression and stress can for sure impact somebody or lead someone to suicidal ideations. Now, I would tell you right now, not everybody living with depression experiences suicidal thoughts, but a lot of people do, but not everyone. And that's an important note to take. And we're going to go into that in a little bit as well. But increased stressors can act as a tipping point to suicide. So something like COVID, for example, right now, we have an increased amount of stress in this pandemic. There is a lot of things that are out of our control, a lot of things that have been taken away from us as individuals. And those increased stressors, those increased changes can send somebody that's already struggling maybe with their mental health over the edge, right? Absolutely. So very important to note that stress in our lives, it plays a big role in how we approach stress, how we view stress can really, really impact what our thoughts are going to be and move us towards potential thoughts of suicide. So thank you for your question in there. So remember that there are multiple factors, and it's not really easy to pinpoint a why people die by suicide, because every single person's reasoning or feelings going into that or having those thoughts can be varied and varied from different points of their lives. So what's important to note as well, especially when working with our elderly youth population, is youth are at highest risk for suicide, but our elderly population are at extreme high risk as well. And a lot of people don't take that into account. A lot of people forget about our elderly population. And it's really important that we note some of those things that we may notice or why our elderly population is at higher risk. And even without COVID, they are. And a lot of that comes with isolation. Our elderly population seems to be a lot more isolated a lot more of the time, a lot more lonely. They don't necessarily have that sense of purpose. Maybe they've lost their partner in their lives. There's a lot of factors that go into how they're feeling and their mental health, and they are very much at risk because of these factors. And we need to remember that when supporting them and just how that would feel for them. So as we're supporting people, we have to start to identify what are those small things that we could possibly notice? What are the behaviors? What are the things that we should be looking out for if we are worried that somebody is at risk for thoughts of suicide? We need to think about this. So just some small notes. So these are things that you as a person from the outside could change, right? So could notice, sorry. These are things that you could be aware of. So these are things that you can sit back and see. So when we think of signs versus our symptoms, so signs are those things, those changes that we see in people, things that other people can notice. Symptoms are those things that people are going to experience that we can't necessarily see, but they're going to feel or they're going to think. So these are just some signs we can look at. So impulsive or reckless behavior. So somebody that could potentially be having thoughts of suicide, they might not care about consequence. They might not worry about what's going to happen to them, and they may put themselves in more riskier situations because they're not worried about those risks, right? Now, statements that make you think. So if you're hearing and you're having conversations with individuals and they are saying little things, or there's little pieces in those words that are making you a little worried, something as similar as, well, no one would care if I wasn't here anyways. Well, I'm just going to sit here. No one's going to come visit me. No one cares about me. If I wasn't here, no one would notice. Those little statements could be a huge indicator that something's going on. So what are the words they're using? How are they describing themselves? What are they saying about themselves? And how are they speaking to you, right? So I see it. Yes, I see a couple questions.
Good. Great minds think alike. So
yes.
Questions piling up, and also I'll tackle the easiest one. May we share your slides with participants after the presentation?
That's okay. Absolutely. I think that you've got a PDF version of them. So for sure you can share these. Absolutely.
Okay. And then so I put a question because you talked about isolation plays a role. And I was wondering, what trends are you seeing as a result of the stress and the isolation? happening through pandemic. And the second question was, does every person have a mental health issue necessarily?
All right, so both fantastic questions. So I'm going to address the mental health question really quickly first. So in terms of mental health, we all have it. We know that we all have brains and we're human. We feel emotions. In terms of mental health problems, we are all going to experience mental health problems. These are situations, events, or challenges in our lives that affect the way that we feel. So these are normal things within our lives. Those are those stressors in our lives that affect how we feel. So they're going to make us go up and down on that kind of roller coaster, right? And that is human. We're going to go through that. But what is extremely important to remember is, how much power do those emotions have? What are the thoughts associated with them? How healthy are those thoughts? How unhealthy are them? And what are the means you're doing to manage that stress in your life? Are you turning to healthy or unhealthy coping tools, like substances, for example? Is that something that you're relying on that's actually perpetuating some of those mental health issues, right? So all of us are going to experience them from time to time, but the only person that can be aware of when those issues or those problems are becoming more severe is you. Being able to identify when your emotions and your thoughts are becoming increasingly more negative, more unhealthy, and they're lasting longer, and they're impacting your ability to go through your day or enjoy some of the things you have before. So we're all going to experience them. And to be honest, everyone, we are experiencing a mental health problem right now. The pandemic has caused a ton of challenges for us, and this is really, really affecting our mental health. And that leads us into the next question. What change or trends have you seen due to the current pandemic? And we have seen a huge increase in the number of people living with mental health challenges, but seeking support. We have a lot of problems right now in terms of backlog for a lot of psychologists, things like that, because people are really struggling right now with all the events that have happened, whether we have lost their jobs, their kids are at home and they are at home and they're trying to balance that work-life balance. Even people that are maybe lived with addiction or in recovery with their addictions have maybe gone backwards because of the strains that COVID has put on us right now. Our elderly population, absolutely, we've seen an increase in that isolation. Even if they weren't mobile or they weren't able to go see people before, they had people coming in to see them. And can you imagine not even being able to have that? That is increase their likelihood. You've heard a lot more about how the elderly population is dealing with this, how much they're struggling with it. And even just imagine the thought of a physical illness, that risk of COVID, and knowing that you're in that higher risk portion, the fears that can be associated with that, especially when we see these higher levels of COVID cases in our nursing homes and areas like that. So we have seen a large increase and a large impact on elderly populations' mental health as a result of these challenges, for sure. And it's very unfortunate, and it's very hard right now, because as much as we want to try to go see and support those people, there's a lot of barriers in place, and a lot of us are being run into the ground, or we're trying to support, but we've also got to support ourselves. So there's a lot of balancing acts going on right now, but we definitely are in a moment where our mental health is in crisis a lot right now, especially for that elderly population. So I'm going to continue on there. I see a couple more questions I'm going to absolutely get to, but I am mindful of time. We've still got lots of information to go through. Just back to what we need to notice, I want you to look for changes of behavior in individuals. So when you see things out of character for a longer period of time, so maybe not just one off day, because we all have our off days, maybe a couple off days, but if you're seeing a consistent change in that behavior for that person, whether it's in their mood swings, whether it's in maybe their eating habits, whatever that may be, a consistent change for them could mean something is going on. Withdrawal, if they're really withdrawing from anyone, not wanting to have conversations, isolating themselves further, can absolutely be a sign that something's going on or their mental health is struggling right now. Loss of interest, misuse of substances, change in appearance. A lot of people that are struggling with their mental health or thoughts of suicide, they're not putting their appearance first, right? They're not caring what they're wearing. They're not caring about showering, things like that. So just noticing those subtle signs. Giving away possessions. We've noticed that a lot of people with thoughts of suicide, if they are very down that road and they are set on dying by suicide, they will give away extremely important things in their lives because they're thinking in their heads, I'm not going to be here anymore. It doesn't matter. Happy and relief. This is one that not many people think about, but a lot of people, if they have made this decision, it's almost like a weight off their shoulders that this pain is going to be gone. This is going to go away. So they almost feel better. You may see a huge shift in that behavior or that thinking, that because they have this sense of relief that I have a plan, this is going to be over soon. So watch out for that as well.
And Brittany, that kind of does connect to the question that somebody posted on the chat.
Yep.
They're wondering why suicide is so negative when a person is able to make their own decision. Why can't they decide to die of suicide?
Yeah, and you know what? That's a huge reason around language too. So when we talk about dying by suicide, that's a really good point, because it's a personal choice for someone. I think a lot of people have a struggle with suicide because a lot of people want to help. A lot of people think, but we could have helped this person. We could have worked with them, worked with their mental health to get them back to a place where they weren't feeling that way. So a lot of people look at it from that sense, right? But we want to look at this as that person died by suicide. Yes, they made a choice to die by suicide. Just like somebody died in a car crash, that's how they died, that's how they passed. But again, you're right, it does have so much negativity surrounded, because a lot of people look at suicide as a selfish act. And they forget to take a step back and empathize with that person and really understand what that person was going through. And maybe that was their only way in their minds to alleviate that pain, right? So that's a way to look at it too. But thank you for that question, because that is something we don't think about a lot. And that's a good way to normalize the idea of suicide, as awful and as horrible as it can be. But imagine you're not in that person's shoes. You don't know what that person was experiencing, right? So really good way to think about it. So, and signs of distress for that one. So let's move into how can we facilitate conversations around suicide? How do we talk to somebody that's maybe having thoughts of suicide? What can we do? So the number one thing that we can do for somebody is sit and listen. This sounds so simple, but as human beings, this is not an easy task. All right. We need to be an active listener. And this can be very challenging for a lot of us, because we love to put in our judgment. We love to talk. We love to tell somebody what to do. But when we're talking to them about their mental health, and more specifically suicide, it's so important that we are sitting back as an active listener. What does that look like? That looks like getting down to their level. So if they're sitting down, let's sit down as well. They're standing up, let's stand up as well, or maybe encourage them to have a seat. Use our body language. Remember, human beings communicate first and foremost through their body language. If we're coming in to talk to someone and we've got our arms crossed, we're looking at the other direction, and we've got this standoff body language, that is absolutely not going to make a person feel comfortable and make them feel like you're ready to sit there and listen. So think about that. Mirror what the person's giving you. If they're giving you eye contact, give them back that eye contact. As you're listening, nod your head to acknowledge that I hear you, I'm listening to you. Remember, their story is their own and not yours. Empathize. We don't want to add in, well, one time when I was feeling this way, I did this and it really helped me. In that moment, this is not about you. This is about them. This is about what they're experiencing. This is about their story. Never offer things like, well, at least you aren't like this. Like, at least maybe you haven't gotten COVID yet. You're not going to say those phrases like at least, because that minimizes the experience that person is having. That minimizes what they're telling you in their story. It is about them, and you need to validate those responses, validate what they're experiencing, so you can hear them and you can get a better sense of where they're at and maybe what they need for support, right? Very, very important. So be in that moment with them. Don't minimize, and try to avoid that glib advice, and don't offer solutions. What that means is, don't say, well, if you just stop drinking, it would help you. Well, if you didn't think that way, you'll feel better, right? Because it's not that simple, especially when someone is in that really difficult place.
Can you give examples of sentences that you could say?
Absolutely.
People, sometimes stumble on their words. It's hard to find what to say in those moments. So if you could give some examples.
For sure. So in terms of validation, simply just saying, I hear you, simply saying, wow, That sounds really hard. That sounds really challenging. What does that feel like for you? How can I help you today? What do you need? What are you thinking? Just asking those questions that really open that floor for them to answer, using language that validates that you understand, validate how difficult what they're going through is, because this pain is so great for them. And you don't want to minimize that. You want them to understand and trust you and understand that you hear them, that this is hard. Now, if you want, I don't have time today, I can't throw it in, but if you want to learn more about empathy versus sympathy, because those are two very different things, Google Brené Brown on YouTube and look up empathy versus sympathy. She's got a great example of what the differences are, because when we sympathize someone, that's when we're putting that silver lining around it. That's when we say things like, well, at least this, at least that. When we empathize someone, we are connecting them on a level to dip into what we are feeling, right? What are the things that we feel that they're feeling, right? So I felt sadness before. So let me think about what I felt like when I felt like that. And that was really, really hard. So finding those types of ways, asking questions, just even saying responses like, you don't always have to know what to say. Sitting in silence can be very powerful, just processing what they've given you. You can fully say to them, I don't know what to say. That can just be so challenging. I'm just here to help you. I want to help you. I care about you. I'm here for you. All right. So those types of things. But the best thing you can do for someone that's struggling is sitting and having a conversation and listening. And when you're doing this, you're listening for those signs, those responses that could indicate if this person is thinking about suicide. And if you have any notion, if you have a gut feeling, if they've said something like, I just don't want to be here anymore, no one would care if I'm here, those little statements, things like that, if you hear that, right then and there, that goes to my brain, this person may be thinking of suicide. So what you can do, the best thing you can do is you ask the direct question. So many people dance around this topic because they don't want to ask this question, but you need to ask the direct question. Are you having thoughts of suicide? Are you thinking about dying by suicide? Straightforward, direct, and honest. Because when you're direct and you're honest, it shows that person that it's okay to talk about it. It's okay. I'll tell you right now, they may have been thinking about it for a while and no one has brought this up, but the second you bring it up, they may be like, oh, wow, I didn't expect anyone to ask me that. I didn't think anyone would think that. Like maybe this is a safe environment for me to talk about my thoughts. Now, a common misconception is that by asking or talking about suicide, you'd put that idea into somebody's head. And that is completely not correct. You will never put the idea of suicide into somebody's head. If they're thinking about suicide, those thoughts are there. If they're extremely struggling, those thoughts may be there. You can never put it in someone's head. So don't even think about that. All right. It's never going to pop in like that. And if they're not, they're not. Now, when you ask this question, be mindful that they might not give you the honest answer. They may say no, but they are thinking about it. So that's where identifying those different signs, going with your gut feeling, hearing what they're saying, and keep on reiterating these questions as you have conversations with them is important. It's okay to go back to this question later in a conversation and simply say, listen, I'm really concerned about you. I want to help. Please let me know if you are thinking about suicide. I'm here for you. And if they do say yes, that's when you go to that next step of asking if they have a plan. Does this person have a plan? Have you attempted suicide in the past? Do you have an idea of how you would die by suicide? These types of questions, because that will give you a sense of how far is this person into this? How much have they thought about this? How much is this consuming their mind? And that gives you an idea on our next step of what type of support do they need? Where do we go next with this person? Okay. But asking those important questions. Be direct, be honest. Yes, I do have a question. I heard someone unmute there.
Yes, Brittany, so this is Zainat again jumping in from the chat. On that note, I think that there's an interesting discussion in the chat about the medical assistance in dying.
Yes, yep.
And the question that is asked in that context is, how do we differentiate, or maybe differentiate even our approach, when between medically assisted assistance in dying and suicide?
So in terms of that approach into like, how do we know like where they're at with that? So I'm sure I'm with medical assistance in dying, they go through a rigorous process, right? A lot of psychological evaluation to do so. But there's so many factors. And at the end of the day with suicide, one of the most challenging things is, like someone had already brought up, it is a person's personal choice. And as much as we as individuals want to help and assist people, we could do everything right. We can say all the right things, do all the right things. But if someone wants to make a choice for themselves, that is their choice. And that is something that's really hard to live with as individuals, maybe that are still living in that person's life after they have died by suicide. So it's really hard to comprehend that. But when it comes to medical assistant dying, there's a lot of different factors. I know there's so much controversy around this subject. I know that there's a lot of rules and regulations, and they're still working towards, what does this look like? How do we differentiate that between it's suicide? Is it suicide? How do we kind of acknowledge that? But again, both suicide and medical assistance is a choice by that person. So they're choosing that for themselves because that is what they believe is the best thing for themselves. And a lot of the times with the medical assistants, they're being tested in the right frame of mind to be able to make that decision. But I know I've had so many conversations with people about this, and people living with severe mental illness that really can't take it. They're fighting for their rights to have a medical assistance because it's just too difficult for them. But that's a really hard one because that one's a lot more opinion based as well. So there is a difference, but there is a lot of kind of gray area around that too. But I guess that's the best way I can answer that. I hope that answered your question as best as I could. I'm still mindful of time, so I want to get through this next piece because this end piece of support and resources is really, really valuable. And I want to have time for some discussion and questions at the end as well. So after we're listening, after we're facilitating conversations, and this may be ongoing with the person we're supporting, it may be daily that we're having these conversations, but making sure we're watching out for those subtle changes, those subtle signs, and those things that they may be saying that may direct us to be thinking they may have thoughts of suicide. And then we ask the direct questions. We ask, do they have a plan? Because that will help us kind of facilitate what is the best route of support for this person. What do I need to do to help this person? And where do I go about doing that? So there is a number of different types of support out there for individuals that are having thoughts of suicide and talking about that. So one thing we can do, of course, is us talk about it, open up those conversations, let them know that we're here to facilitate that conversation with them. If they do even start having those thoughts, right? If their mind starts to go there, and anyone can have thoughts of suicide, it's okay to talk about it. So we need to look at community resources. We need to look at what are our next steps. So there's a number of different ways we go about this. And the number one thing I say to everyone, if you are concerned about someone that is having thoughts of suicide or that has expressed thoughts of suicide, the number one thing we don't do, never leave that individual alone. So if you've had a conversation with someone, this has come up for you, we cannot leave that individual alone. So there's a number of different ways that we can make this happen depending on how severe the situation is. But the best thing we can do, keep them with somebody else, keep them safe by keeping them around people. And again, that looks different depending on the situation and the person. But what's important is to discuss options with the individual. So if the individual has expressed to you, yes, I'm having thoughts of suicide, I have a plan, that is pretty much on a crisis point, and we need to discuss options with that individual. We're not going to want to leave that individual alone. We want to get them help. So we want to help discuss options. Now, this is where it gets really, really tricky because we as support people want to assist that individual. We want to help that individual, but we cannot force. The only time we may be able to force an individual is if we actually fear that their life is at risk, that somebody else's life is at risk. And when it comes to suicide, that risk is there, it's high. So we need to turn into an action plan and what that action plan looks like. So what I would first tell you to do is when talking to the individual, I want you to ask the individual what they need, what's their options. And if they say nothing, I just want to be here, I don't care anymore, you say, well, here are your options. We can call a crisis support worker, or I can call 911 and you can go to the hospital. Which one do you prefer? The biggest thing you want to try to do for individuals is you want to empower them through choice. You want them to have choice through their care. So often than not, people with mental health challenges, they have choices taken away for them or made for them. And that's not really going to help them on their road to recovery. We need to invoke empowerment into these individuals for their own care, just like with medical assistance and dying. So what we were talking about in the chat, we want to empower people to make their own decisions about their own life and their own support. But at the same time, I know we want to keep them safe. So by offering them options, that gives them the ability to make the decision and make them feel like they are in charge of their own care. Now, of course, if safety is a massive concern and we can't get to that point, then we are going to have to make that decision for them, but we are going to try our best to seek that advice. So what are those options? I'm just going to paste a couple crisis support lines into the chat right now, because I think those are really important. I know we are maybe coming from different parts in Ontario. Oh, I think I just directed Caroline. Sorry, Caroline. I'm going to make it go to everyone now. But one thing that we do have at our disposal, and I know Peel Dufferin's been doing a fantastic job, is our crisis response teams. So if you are concerned for someone's safety, concerned for risks of suicide, your crisis support teams are your number one, good, Caroline feels special, is your number one supports, okay? So these are the teams that can come and assist you. They're also the teams that if you aren't sure what to do as an individual, you can call and ask for direction. So look up your local crisis support teams within your community. I've listed some for Waterloo, Wellington, Toronto, and then the first one for Peel Dufferin. So these lines are a fantastic resource. Peel Dufferin has teamed up with the police service, and you will have crisis support workers and police officers not dressed in uniform come to your house to assist you and to help you with that call. Now, I know resources are limited, so it may not be that specific team. They may have to send other teams, but this is a great start. So if somebody is at risk, has acknowledged that they are thinking of suicide, talk to your local crisis support teams. When we talk about our elderly population, empower them as well. Ask them what their options are. Ask them, what can I do to help you? I want to help you. What can we do? Can we call this crisis line? Can we talk to them? I don't want to leave you alone, so I'm going to call them, right? So make sure you're helping them, you're using this language, and you're offering them these types of supports to assist. And of course, if they're not complying, if they're not listening and you're worried, then absolutely you can call and ask for direction from these types of supports as well. All right, so make sure you're empowering them to make those decisions themselves. You also have the hospital. 911 is always an option if you're really not sure what to do. I like to turn to crisis first, because 911 and police officers can be traumatizing for some individuals experiencing thoughts of suicide. So make sure you're making that call when absolutely necessary. Even just helplines as well can be really important. Yes, so there's Toronto senior support lines available. I've got some information that I'm going to throw you in a second with some more senior supports too that can be really, really helpful. But crisis teams are your go-to. Now, in terms of ongoing support, empowering people to reach out to ongoing support that are struggling with thoughts of suicide, whether that's therapy, talking to a family doctor, friends, colleagues, and family members, external resources, interest goals, things like that, trying to get even our elderly population encouraged to do activities and things like that as best we can to keep them busy, to keep their mind busy, to get them to focus on different things that will help them. Because one thing that I know for sure with our mental health, our mental well-being takes time to nurture. It's a bunch of different pieces coming into that puzzle. So somebody with thoughts of suicide, it's not just about the crisis support team today. What about tomorrow? What about the next day? What about a week after that? Especially with our elderly population, let's continue on checking in on them, it's right now more than ever with this pandemic, with these extra stressors that we all have on us, we must be checking in continually. Helping them build routine is extremely, extremely helpful. Now, one thing I do want to make note of for all of us is if we're supporting someone with thoughts of suicide, we have to remember ourselves. Now, it is very challenging to support somebody that's been living with thoughts of suicide or struggling at that moment with their mental health. So we need to make sure that we're equipped to assist them, that we can come in and listen non-judgmentally. We can come in and sit down and having an open, empathetic conversation. All right. So I want to make sure that first and foremost, all of you are helping yourselves. And if you're not equipped to help that person, acknowledge that. That's okay. Just say, I'm not okay to do this, but help them set up someone who can help them, right? Encourage them to reach out to those supports. So make sure that we have that plan in place. But at the end of the day, the number one person is you, and we can never support someone if we're not supporting ourselves. We have to be able to support ourselves in order to support other people. So make sure we're doing those things that keep us healthy and well, because all of us are at risk for thoughts of suicide. Even people that don't live with mental illnesses are at risk for suicide. Very important to remember that. Not everyone with thoughts of suicide has a mental illness. Even people that don't have any sign or any diagnosis can have thoughts of suicide, especially when there's outside stressors coming in that are affecting our lives. Another important note is that people with self-harm doesn't indicate suicide. Self-harm can be very separate from suicide, and somebody can be utilizing self-harm as an unhealthy coping tool without having thoughts of suicide. So those two things don't go hand in hand together. Really important to note that as well, because that's not always a sign of suicide. That's why asking direct questions is important. Ask about suicide, everyone. Use the appropriate language around suicide, and make sure you're opening up these conversations and you're being willing and able to be an active listener to really help people, because at the end of the day, these people are struggling, they're hurting, and they're living with a lot of challenge, just like we all are right now. But more than anything, they just need to know that someone cares and someone is there. So I am mindful of time. I know we got 10 minutes left, so I want to open it up to questions, but I do want to direct everyone that if you do want to look into your local CMHA, they can really help you with resources in your community. We have things like quick guides. I normally hand these out, of course, in presentations, but they have tons of senior services, senior crisis services, information on varying shelters, different types of services in them, which are all located online on Peel Dufferin's website. So if you're interested in grabbing more resources information or finding your local CMHA, please go onto that website to find them. And I'm just going to leave up a little bit more information and resources you can look into for more assistance and help. I know we went through tons of information. I have so much, I wish I could stay and talk with you all day, but I do want to turn it over to Ina. Let's open the floor for some questions. If I missed any questions, I apologize. I'm making sure I get through all the material. But make sure we're opening up, having conversations, and let's normalize this challenging topic in these challenging times.
Thank you so much, Brittany. It's been a great and very practical and also insightful presentation. I would say for me, I've never thought about the negative language around suicide so much, at least not as deeply as you've raised it today. So that was certainly enlightening. I wanted to start off our discussion with a question by Carolyn that is saying that there is a huge issue with telephone contact within seniors that are in long-term care homes and retirement homes. So they don't always have access or even the privacy to reach out and have those conversations. Carolyn, I don't know if you wanted to unmute and say more about that so we get more of the context and maybe can kind of provide some suggestions.
Sure. Of course. We're dealing with that now. There's a group of 4 semesters who are on a team with me studying, trying to get access, digital access to seniors in Toronto, because there are people who don't even have digital access, and a lot of the resources and activities and social networking is happening with older adults online. And so there's a whole group of older adults that either don't know how to use online, don't know how to use the device, or can't afford the access to the device and the internet. And so we have to find them. There's telephone support going on. I know our students are doing, and the alumni and the community partners are doing a lot of work around trying to do telephone support, but it's not reaching enough of the seniors out there, and they have to be able to hear the phone. They have to want to pick up the phone. We may not know whether they're alive or not in their home, or what's happening with them because of the COVID isolation protocols. It's been so severe. So there's a huge gap that I'm not sure how to close in terms of even connecting with these seniors that are now so isolated, even within long-term care facilities and retirement homes, within their suites or their rooms, are so isolated and so vulnerable, and there's just not enough staff to connect them to other people, and they're being isolated through COVID. It's just been impossible, and the levels of depression and suicidal thinking has gone up. I mean, absolutely has gone up. I don't know if they're actually doing stats on it, though they should. And it's a concern. So how do we then reach people during COVID that we can't normally that we normally could reach and now can't?
I wish I had all the answers for you, and you are absolutely correct. With COVID, it has added in so many more barriers and so many more challenges specifically for our elderly population. And that's a perfect example of it. With all of these new restrictions, with all these new limitations, how can we actually even connect with these individuals? And a lot of them don't have that level of technology that a lot of us in the working force, or maybe the younger youth, do have, and or even just the ability to utilize that technology. And I wish I could help that answer, but I don't know what to do right now. And obviously the government doesn't know what to do, and they're not seeing this as how big of a problem it actually is, because seniors are at risk even before COVID. So adding this in right now, their risk has gone up exponentially, and we have to find ways to be able to support these people. We have to find ways to get them to communicate with others. So I'm sure that advocating for this, and even just PSWs, the amount of work that those people are doing, and having this on top of them to be able to support those people or have these conversations or are seeing this firsthand, is a complete struggle. So I think that Kimberly wrote to everyone, have you thought about phone programs? So generating these programs to assist with this, but even just hearing could be a huge barrier to even just talking on the phone for a lot of these individuals. So finding these answers right now is really challenging. But what I'm hoping is that this kind of brings us up on the other side, that this is actually teaching us that, hey, even maybe when COVID starts to kind of hopefully go away a little bit, we don't know what that's going to look like, but long term, we need to support our elderly population. They need to have more things available to them. So we are not only supporting their physical health, but their mental health as well. So yeah, Caroline, I wish I had a specific answer for you, but I'm not too
expecting
sure.
it from you. I mean, we're a think tank, and we don't have the answers yet.
I know.
But there are phone programs, but again, they're inefficient and ineffective because, first of all, we have to know who these people are, and we don't capture all of the seniors out in the community. And second, they have to be able to get to a phone, and even in long-term care and retirement homes, they can't get to their phones.
Exactly.
Be able to hear on the phone, and they have to have the cognitive ability to hold a conversation and the energy. And it's just been brutal with COVID. There's no, where you used to be able to knock on a door or peek in and say hello, it's not there anymore.
Absolutely.
Carolyn, you bring such a great consideration, and it's something that we are all struggling with, I think, across the system right now, but especially I think in those kind of aggregated living settings where there is very little staff and all of this with many seniors that they need to serve, quite complex. I would say that your question triggered me to think about how during this pandemic, we've implemented a lot of remote monitoring, and how can we use that more sophisticatedly beyond just monitoring COVID symptoms and just monitoring how those complex people are doing in their home or at long-term care homes. I think we need to be proactive. I think we need to be proactive in raising this conversation in our homes, raising those discussion with the team to see how can we be proactive internally when we go and say good morning or serve the breakfast or the lunch or dinner. What question can we ask? What can we pay attention to? So that at least we can be alert and when something does happen to identify it. But as Brittany said, no easy answers. And thank you. I think some people are sharing some more resources on the chat. So I will not close the session right away to allow people to soak that wonderful wealth of information that people are bringing into the session. So please go through that. Please respond to the poll questions before you exit the session. And I do want to take this opportunity to really thank Brittany for a very engaging and interesting and enlightening presentation and a very important topic. I want to thank our moderators, Salma and Agnes, for supporting us today in the session, and of course to everybody for participating. Thank you, everybody. Hang in there. It's a new year, hopefully a better one. So please keep well and safe. Thank you, everyone.
Yes, thank you everyone so much. And I appreciate all of the feedback as well. And absolutely, please stay as healthy and as possible during these challenging times. And remember to support everyone and check in on those in your life, especially those elderly population. So thank you again so much, everyone, for having me, and have a wonderful rest of your day.